Thanks for the opportunity to share our work. I'm Candace Chow. This is Nguyen. This is Nguyen. I want to also acknowledge Dr. Gretchen Case, who's in the audience, and our colleague, Dr. Carly Pippett, who couldn't be here, but who has been instrumental in this work. So I'm going to start by just introducing two of the concepts we talk about, interrupting bias and forum theater, and then Q will follow up with the data that we've been collecting. So interrupting bias is exactly what it sounds like. It's when you see bias happening, you step in and you say something or you do something. And research sometimes refers to this as confrontation. And the really interesting thing that research has found is that interrupting or confrontation can be really important because it not only affects the individuals in the encounter, but also has a potential to make an impact on the bystanders who are watching, who can learn from the confrontation and then incorporate that into their own practice. Unfortunately, as I think a lot of us know, interruption is not something that comes easily or naturally. It's something that needs to be practiced. And so it's something that we've been trying to teach faculty how to do through the use of forum theater. So forum theater was created by Augusto Boal, who was a Brazilian activist and also a theater practitioner. And he saw that a lot of his fellow citizens were experiencing oppression that they could not respond to because it was not safe. If they spoke back to law enforcement, they would get arrested or they would be physically harmed. And so as a theater practitioner, he turned to theater as a way to help people work through these incidents. And he would have them reenact scenarios from their own lives that they had experienced and use theater as a way to then respond and take on different roles, different responses that they couldn't actually do in real life, but could do safely through theater and work through these different responses. And so that's something that we have adopted, have tried to take on in our training. And the idea, I think the important thing about forum theater is that there's no one right answer, no one way to respond to bias, but it's a process of figuring out what works for you and feels comfortable enough so that you can do it in that moment where you need to respond.
Using forum theater, this workshop was conducted with students and faculty and administrators, although here we present data from one workshop with primary care faculty only. The primary care faculty were invited to attend this workshop in place of an administrative meeting. And then following the introductions of the facilitators and backgrounds, the faculty were asked to practice using interrupting techniques to call in and call out language on a Zoom platform. The 60-minute workshop was conducted with only 2 facilitators to guide these role assumptions, responses, and reenactments, as well as to facilitate discussions. Following the workshop, surveys were conducted anonymously, and in this cohort we received 14 survey responses. 93% of the faculty shared that they had done DEI trainings in the past. And during the questioning, we asked their likelihood of engagement with interrupting on a scale of 1 to 5, with 1 being very uncomfortable and likely to avoid, 2 being difficult and unlikely to try, 3 was difficult, but they could do it, so kind of pushed. 4 difficult and would likely to try, and then 5 was very comfortable and would do it. Despite most of the participants, 93%, having had experiences with DEI trainings, when we queried the faculty, we found that 72% of survey respondents were unlikely to try interrupting. Following the training, the number of respondents who were likely to try went from 7% to 57%. The percentage of respondents who found interrupting to be difficult and unlikely to try went from 21% down to 0. The shift in the attitude really reflects the change from a pre-contemplative model to a more execution stage of thinking, similar to what you can look at when you're looking at behavior change with other difficult frameworks and motivational interviewing. Participants also shared separately in their feedback to us that these skills are really critical to practice. The leaders created a safe environment to practice, and that they liked the options for specific language that one can use during a challenging situation. These findings also demonstrate that there's more opportunity for using interrupting bias using forum theater. And this approach could present safety for faculty who are visible leaders in health systems and may take on additional risk when they are interrupting, and could use the support to do so. Any questions?
Question back.
Yes, please.
Thank you. Great presentation. Question, what was most challenging in incorporating forum theater with this population?
What was challenging?
Most
Yeah, what was most challenging?
Challenging about incorporating forum theater with this population.
I think that we are not allowed to call it role play because every health profession, clinician and educator knows that role play is a bad word in health professions education.
Yeah. And I think, you know, challenging was also getting people to kind of jump in a little bit, right? And so using the pause and kind of pushing that moment. But before we started the discussion, we also did a little introduction about bias and normalizing bias as a human, cognitive, often subconscious skill. And so these conversations are supposed to be open. And so I think that helped people kind of just jump in as well and understand that it was just a learning platform and that we were moving to better, not best, and that there wasn't one answer to any of these scenarios.
I have a quick question. So you said this was all done on a virtual platform.
Mm-hmm.
I wonder if you would hypothesize any differences in the in-person setting. You know, would people be less likely to interact because it might feel less safe, you know, in sort of company? Is that, are you guys gonna pursue evaluating that as well, or?
Yeah, and I see Gretchen, you raised your hand, right?
We have done it.
Oh, of course you did.
Yes.
Okay.
This is just one, but we did it in person.
Was there any difference?
A huge difference. It's a different platform. I mean, doing it in person, you just adjust, but I think you can do the same, like norm setting, inviting people in. It's just a different way of saying like, this is okay.
And the practice of setting precedent. Very cool. Thank you.
And I'd also say too, as clinicians, like we've done this with theater students, we've done this with undergraduate medical students. And one thing about the Zoom was people didn't have to stand up and go out. And so in some ways it almost, like I felt like when I've done these, that sometimes people felt like there was actually a little bit less exposure. So, you know, I thought that there's different strengths from each of the style of trainings. And so, but the nice thing was that it could be done in this forum with, I think, still a lot of learning.
I'm wondering if you looked at people whose English is not their first language. I mean, being able to jump in, that's hard to do if it's not your first language.
Yeah, we hadn't looked at that. Some of the limitations is how much time we can capture to get people to answer any of our questions at all. But given that they were faculty, most of our of who was presented here had, you know, generally pretty good comfort with, I think, stepping in.
Well, this just opens up a lot of questions. It's really exciting, really interesting. I have to say, just to say personally, I've been interrupted to be corrected before, and it was very impactful. And I remember right where I was sitting. I remember everything except what I was corrected on. And I'm really serious, really, like I was really searching. I was like, what did I learn from that? And then I also felt that, you know, it was maybe what other people learned too that was important about that. But I was mortified, and it just makes my heart race just to think about it. And I don't remember what I was corrected on.
And I think that's why these questions are paired together. There's like initiating interrupting, but there's also responding to interrupting and understanding where someone is coming from, right? Because we all have that emotional human response. Right. And so the only way to kind of be able to move past that is, we've talked about simulations, we've talked about forum theater, practice. And practice specifically, I think, in professional educational settings.
Yes, yes. Well, that was really great. Well, very, very, very interesting. Thank you.